I want you to picture something sitting on your desk right now. It's a stack of papers stapled in the corner, maybe a little crinkled.
Hmm.
It looks like the most boring thing on earth. It's got a government seal at the top, a file number 2018-0276-0857, and a list of names.
Right.
It's titled Verdict at Coroner's Inquest. It's from British Columbia, dated just this past January 2025.
And if you were just scrolling past this or flipping through a file cabinet, you wouldn't give it a second glance.
Not at all.
It looks like, standard bureaucratic housekeeping.
Right, it looks like a tax form. But when you actually sit down and read it, when you get past the procedural jargon, the formatting this document is terrifying.
It really is.
It maps out in excruciating detail the catastrophic failure of a safety net that is supposed to protect the most vulnerable people in our society.
It's not just paperwork. It's a blueprint of how a system can be fully operational, fully funded, and yet completely blind to a tragedy happening right under its nose.
That's it exactly. It is a genuinely difficult read, and not because the language is dense, but because of the timeline it lays out.
Right. It shows how you can have a system that exists on paper, complete with checklists, contracts, oversight bodies, all of it. And yet, it failed to see a human being dying in plain sight.
And that is exactly what we are digging into today. This isn't just a true crime story, although, there is a crime involved. We need to understand the mechanics of this.
How the system itself failed.
Yes. How do standards exist while verification fails? The primary source here is that verdict at Coroner's Inquest regarding the death of a woman named Florence Marie Gerard.
The inquest was held at the Burnaby Coroner's Court. It involved 18 witnesses and 19 exhibits.
And maybe we should clarify what an inquest is, because it's not a trial.
No, it's very different. A criminal trial is about guilt. An inquest is a fact-finding mission. It's about prevention.
Okay.
A jury sits down, looks at a death, and asks, how did the system allow this to happen, and what specific rules need to change so it doesn't happen again?
So it's basically a systemic audit, written in the language of loss.
That's a very good way to put it.
So let's start with a human being at the center of this. Who was Florence Marie Gerard?
Florence was 54 years old. She was born with Down syndrome. And her history is really reflective of how society has treated people with developmental disabilities over the last few decades.
How so?
She was placed in government care when she was very young. So for almost her entire life, she was a ward of one system or another.
She was always reliant on the state for her housing, her food, her safety.
Completely.
And I think it's crucial to establish her physical baseline. Before the events that led to her death, what was her health status?
Well, the profile paints a picture of a woman who was actually struggling with the opposite of what eventually killed her. Prior to the neglect, she was dealing with obesity.
Really?
Yes, she weighed approximately 170 pounds, and she also had severe osteoarthritis in her left hip.
So she had mobility issues.
Significant mobility issues. She wasn't someone who could easily leave the house or, walk to a store or advocate for herself physically. She was dependent.
Okay, so keep that image in your mind. A 170-pound woman, limited mobility, living in a private residence in Port Coquitlam. Now fast forward to October 13th, 2018.
This is the day she was found deceased.
Describe the scene.
It's harrowing. She was found on a mattress on the floor.
Okay.
But the detail that just stops you cold is her weight. Remember, her baseline was 170 pounds. When she was found, she weighed 50 pounds.
50, like 50.
50. 52 pounds to be exact.
Can't even, I'm trying to visualize that. That's the weight of a first grader. That's not an adult woman.
It's horrifying. The forensic pathologist testified that the cause of death was starvation and malnutrition.
And we have to be clear, that's not a sudden event.
No. This is a slow, agonizing process. The testimony indicated it would have taken more than a month of absolutely zero food or many months of severe underfeeding to reach that state.
So this was a slow-motion deterioration that happened day after day, week after week.
Exactly. You cannot miss a person losing 2/3 of their body weight. It is visibly shocking.
Now, obviously, there is an immediate person to blame here, the woman she lived with, the home share provider, Astrid Dahl.
Right.
We know from the background she was eventually found guilty of failing to provide the necessaries of life. So there is individual criminal accountability.
Yes, and that is important. Dahl was the one in the room. But if we stop there, if we just say Dahl was a bad apple, we miss the entire point of the inquest.
We miss the systemic failure.
Exactly. Florence wasn't just living with Astrid Dahl in a vacuum. She was part of a massive regulated provincial system designed specifically to prevent this. The question the jury had to answer was, where was everyone else?
That's the part that breaks my brain. How does a government system lose a person to starvation?
Well,
I think most people, including myself, have this assumption that if you are in care, there's a direct line from the government to the patient, like a nurse in a hospital. But that's not how this works.
no, not at all. And understanding this structure is key to understanding the failure. It's not a straight line, it's a chain.
A chain. Okay.
And every link in that chain diffuses responsibility a little bit more.
Walk us through the chain.
Okay, so at the center, you have Florence. She is living with a provider, Astrid Dahl.
Mm-hmm.
But Dahl is not a government employee.
She.
She's an independent contractor.
Wait, independent contractor? That sounds like an Uber driver or a graphic designer. Why is a full-time caregiver a contractor?
It's the primary model for community living in BC and many other places. The government doesn't want to run the homes directly. It's expensive. It carries massive liability.
So they contract it out?
They contract it out. Dahl is essentially running a small business of caring for Florence.
Okay, so the government offloads the liability to Dahl. But who holds Dahl's contract?
The contract is held by an agency. In this case, it was the Kinsight Community Society. They are a nonprofit that coordinates the home share.
So Kinsight manages Dahl. Who manages Kinsight?
Kinsight gets its funding and mandate from CLBC Community Living British Columbia. That is a crown corporation.
Which is basically a government-owned company.
Right. And then finally, CLBC is funded by the Ministry of Social Development and Poverty Reduction.
So let me get this straight. You have the ministry funding CLBC, which funds the agency, which contracts the provider to care for Florence.
Mm-hmm.
That is 4 layers of separation between the tax dollar and the actual human being.
Exactly. And in theory, those layers are supposed to be safety nets.
Yeah.
More eyes. Right.
Right.
The agency watches the provider. CLBC watches the agency. But the inquest highlights one specific role that is the absolute linchpin of this entire structure.
And what's that?
The home share coordinator.
This is an employee at the agency level at Kinsight.
Yes. This is the person whose specific job description is to ensure the contract is being followed. They are the bridge between the bureaucracy and the living room.
And if that bridge collapses?
The person in the home is completely isolated.
So let's look at how that bridge collapsed. Because this is where the paper reality versus the actual reality theme really hits you. The source material lists a series of checks that were missed that just seem impossible.
It's a cascade of silence. First, there's the reporting. Dahl, the provider, was required by her contract to submit reports on Florence twice a year.
Which seems like a pretty low bar to begin with. 2 reports a year.
Very low.
Right.
But the inquest found absolutely no records of reports submitted for 2017 and 2018.
So for 2 full years, there is 0 paper trail coming out of that house, and the system didn't flag it.
Apparently not effectively enough to intervene.
Mm.
And then there was the medical gap. Florence hadn't seen a doctor since February 2014.
Hold on. From 2014 to late 2018.
That's right.
You have a woman with Down syndrome, severe osteoarthritis, and she doesn't see a doctor for over 4 years. How does a caregiver even justify that?
This is a really tricky area, and it's where the system's own values were effectively used against it. Dahl claimed Florence refused to go. She testified that Florence's right to say no had to be respected.
Self-determination.
Precisely. We want to respect the autonomy of adults with disabilities. We moved away from the institutional model where patients had no say.
But this is the dark side of that.
Right. The inquest really highlights how that concept can be weaponized, intentionally or not, to mask neglect. If she refused, becomes a blanket excuse for 0 medical care for 4 years, oversight just vanishes.
I get the autonomy argument, I really do. But at some point, doesn't common sense kick in? If I'm that coordinator, that linchpin, and I see no doctor visits since 2014 and no reports since 2016, surely I am going to that house to lay eyes on her myself.
You would think so.
Did they?
This is the crucial aha moment of the entire verdict. It's the detail that makes you want to pull your hair out.
Huh?
Yes, visits were required every 3 months. And technically, the coordinator was compliant with the visit standard.
I'm confused. If they visited every 3 months in 2018, I see here, February, August, September, how did they not see a woman starving to death on a mattress?
Because, and this is almost hard to believe, the standard at the time did not explicitly require them to see the individual receiving care.
You have to be kidding me.
I wish I were. The standard was to visit the home share, not necessarily the person.
What does that even mean?
The inquest details specific examples. The coordinator would visit the home or even meet Dahl at a coffee shop.
A coffee shop. So they are doing a welfare check on a vulnerable person by drinking a latte 3 miles away.
Effectively, yes. They would meet Dahl. Dahl would say, Florence has the flu, or Florence has Alzheimer's and is sleeping, or she doesn't want to come out.
And the coordinator just accepted that.
They accepted those excuses, and they checked the box.
They checked the box that said, visit completed.
Yep.
That is the definition of administrative theater. They are measuring the paperwork, not the person.
Exactly. Florence Sherrard didn't die because a box was unchecked. She died because the box was checked compliant while she was dying in the next room.
It just forces you to ask, what are we actually measuring?
Are we measuring safety, or are we measuring contract compliance?
But I want to pause here and look at the coordinator, because it's easy to paint them as the villain, the lazy bureaucrat. But the inquest suggests the environment they were working in was impossible.
That's a vital piece of context.
Yeah.
You can't look at this without looking at the workload. The inquest noted that this specific coordinator had a caseload of 25 individuals.
25? Is that high?
It's incredibly high for complex care. Imagine you are responsible for the lives of 25 people with significant needs, living in 25 different homes spread across a city.
You're just chasing paperwork?
Chasing paperwork, dealing with crises, driving between locations. The jury clearly thought this was dangerous because one of their specific recommendations was to reduce that caseload to below 25.
It turns the job into a race. You're just trying to clear your desk. You don't have time to use your intuition to notice that something feels off at Dahl's house because you have 24 other houses to get to.
Precisely. If you are rushing, you are more likely to accept the excuse she's sleeping, because it means you can move on to the next fire you have to put out.
And then there's the money issue. The provider, Dahl, testified she wasn't paid enough. Now, obviously, low pay is no excuse for starving someone. Let's be crystal clear on that.
Absolutely not. But structurally, the low pay creates a risk.
Oh, so?
It creates a massive risk. Dahl testified she feared being labeled a troublemaker if she complained about money or support. She thought they would take Florence away, and she would lose her income source.
So you have a system running on fear and scarcity. Providers scraping by, afraid to speak up, coordinators overworked.
And the inquest addressed this head-on. The jury recommended an immediate increase in compensation for providers to a living wage, indexed to the CPI.
Right.
They noted the current funding covers little more than room and board. And they also recommended increasing coordinator pay to match government social work positions.
Why does the coordinator pay matter so much?
Retention. If you pay coordinators poorly, they quit. If they quit, you have high turnover. And if you have high turnover, you lose institutional memory.
Right. If there's a new coordinator every 6 months, nobody knows that Florence used to be 170 pounds.
Exactly. A coordinator who had known Florence for 5 years would have walked in, seen her at 120 pounds, and panicked. A new coordinator walks in, sees a frail woman, and might think, well, maybe this is just her baseline. Memory is a safety feature.
So let's pivot to the fixes. The jury came back with a list of recommendations. We've touched on caseloads and wages, but they also talked about modernizing the tools.
Right. Recommendation number 1 is very specific. Develop a unified case management system.
Which sounds like corporate speak. But what does it actually mean for safety?
It means moving from paper to digital. The testimony revealed a reliance on paper-based tracking. The recommendation is for a digital system accessible by CLBC, the agencies, and health professionals. And it needs to be able to send alerts.
Alerts seem key here. If a report isn't filed for 2 years, a computer should be screaming at someone.
Exactly. Or if a doctor's visit hasn't been logged in 12 months. An automated system doesn't accept she has the flu as an excuse for silence. It just flags the gap.
It removes the human error.
It removes the element of just forgetting to check a file.
And what about the coffee shop loophole? The visits.
Closed. Or at least the recommendation tries to close it. Recommendation number 8 calls for CLBC analysts to conduct risk-based, randomly selected, and unannounced home visits.
Unannounced is the operative word there.
It changes the power dynamic completely. If you know an inspector could knock on your door at 10 a.m. on a Tuesday, you cannot hide the condition of the home or the person.
And the focus is on the person.
Explicitly. The recommendation says the focus must be on verifying physical and mental well-being, not just paperwork. They are telling the system, look at the person, not the file.
There was also a point about definitions. Recommendation 9 and 10. It seems technical, but it really mattered for Florence.
It mattered immensely. The standards need to actually define healthcare planning. Florence didn't have a specific care plan because she wasn't considered complex enough by the system's metrics.
Wait, she had Down syndrome, severe arthritis, couldn't walk? How is that not complex?
That was the determination. And because of that classification, she didn't trigger certain planning requirements. The jury is saying, define these terms clearly so people like Florence don't fall into a semantic crack.
A crack where they don't qualify for a plan that could have saved their life.
Exactly.
Now, I want to bring up a statistic that came up in the inquest that I found. Well, complicated. A CLBC witness testified that 98% of recommendations from a 2021 Auditor General report were implemented.
The 98% implemented stat. This is where we need to put our critical thinking caps on.
Because 98% sounds like an A+ stat. It sounds like we fixed the problem.
But you have to ask, what is the definition of implementation? In bureaucracy, implementation often means we updated the policy manual or we sent out a memo.
So they measure the activity, not the outcome.
Precisely. You can have 98% implementation of paper sixes and still have 0% verification of Florence's weight loss. This is the implementation gap. We often mistake the activity of checking boxes for the achievement of safety.
And the coroner seemed to sense this invisible data problem, too. There were separate recommendations regarding the advocate for service quality.
Yes, the advocate is an independent office. But currently, and this is startling, this office does not automatically receive reports on deaths, critical injuries, or near misses.
Wait, the office designed to advocate for service quality isn't told when the service kills someone?
Correct. Recommendation number 15 is that all such incidents must be reported to the advocate. Without that, the data remains invisible to independent oversight.
You can't fix what you don't measure.
And you can't measure what you don't report.
So bringing this all together, we have a tragedy that happened in 2018. We have a verdict in 2025. In that time, Kinsight, the agency, says they've made changes.
Right.
They've added team leads. They've got new software called ShareVision.
They have. And it's important to acknowledge those steps. The two sets of eyes. Policy Kinsight implemented, where if a coordinator can't see the person, they have to go back within a week or send a supervisor. That is a concrete improvement.
That fixes the coffee shop problem directly.
It does. But the structural issues, the caseloads, the wages, the sheer size of the system, those seem harder to fix.
The resource issues.
They are. You can rewrite a policy for free. Reducing caseloads from 25 to 15 costs millions of dollars in new hires. Paying a living wage costs millions. That is where the rubber meets the road.
Are we willing to pay for the level of safety we say we demand?
That's the question.
It really comes back to that central theme we started with. Acceptance is not implementation.
And implementation is not verification. And verification is the only thing that saves lives. You can accept a report, you can implement a standard, but if you don't physically verify the human being standing behind that file number, the rest is just administrative theater.
It leaves us with a really provocative thought for everyone listening. We often feel safe because we know regulations exist. We assume that because there is a government agency, someone is checking. But this inquest peels back the curtain and shows that checking can mean very different things.
It forces us to ask, in 2025, do we finally have a system that checks the person? Or are we still just checking the boxes? Because Florence Sherrard didn't die because a box was unchecked. She died because the box was checked compliant while she starved.
That is a heavy realization. We've linked the full verdict document in the show notes for those who want to read the recommendations in full. It's a dense read, but if you care about how our systems actually work or don't work, it is worth your time.
It's a blueprint for what needs to change.
Thanks for diving deep with us today. This one was tough, but necessary. We'll see you on the next one.